laser and light treatment for hidradenitis suppurativa, or HS. This is purely an information video, and watching does not confer competence to perform the procedure. Aims and objectives: patient selection, equipment and setting, consent, relief from discomfort, procedure steps, and post-procedure care. Patient selection. Laser and light treatment for hidradenitis suppurativa targets the hair follicle, and so laser and intense pulsed light, or IPL, otherwise used for hair removal treatment, are required. HS of any severity can be treated, including both active HS skin lesions, as well as preventative treatment of unaffected neighbouring skin. Those with white, red, or grey hair will generally have less response. The selection of which laser or IPL treatment to consider is influenced by background skin tone. Several skin regions can be treated in the same session, depending on the time available and the person's tolerance of discomfort. Laser hair removal, or IPL treatment, is particularly good for scattered skin lesions on the skin's surface, and is unable to treat deeper scarring from HS, such as skin tunnels. This video will not cover carbon dioxide ablative laser therapy, which is sometimes used in HS to perform local skin surgery by cutting the skin, and does not target the hair follicle. Equipment and setting. A laser procedure room is required, which conforms to laser safety requirements. Both the operator and patient must wear safety goggles. It can be helpful to mark the area to be treated with a skin pen and take a photograph to confirm the treated area for subsequent procedures. Laser options include Nd:YAG, alexandrite and diode lasers, and some machines provide more than one option. The machine settings will be those provided by the manufacturer for hair removal. Nd:YAG is suitable for Fitzpatrick skin types 2 to 6, while alexandrite and diode lasers are suitable for skin types 1 to 3. Intense pulsed light, or IPL, is another non-laser option. Consent and risks. Consent for the procedure should cover general laser safety issues, particularly use of goggles. A degree of pain or discomfort should be discussed, covering both the time of the procedure and afterwards. Local skin reactions are possible, including redness of the treatment area, itching or mild irritation, swelling or tingling, which usually disappears within 2 days, surface bruising or purpura, and skin breakdown or skin blisters in a few cases with a more severe reaction. Increased or decreased skin pigmentation is possible and is more likely for patients with darker skin tones, such as those of Fitzpatrick skin type 6. Oral tetracycline therapy, particularly minocycline, should be avoided for 1 month before treatment, because this increases the risk of hyperpigmentation. Other photosensitizing drugs should also be avoided. Treatment may be ineffective despite a full course of therapy, and there can be recurrence of active HS within the treated skin region. Relief from discomfort. Many laser or IPL devices have a built-in cooling spray, or otherwise a cold compress can be used. A local anesthetic cream can be applied, or in some cases a local anesthetic injection might be offered. Oral pain relief can be taken before treatment or after treatment. However, non-steroidal anti-inflammatories should be avoided pre-treatment because these rarely can cause photosensitivity. Procedure steps. Patch testing is mandatory and involves treatment of a small test patch using the same laser and settings intended for a subsequent treatment appointment to identify any local reaction or dyspigmentation issues. The site should be marked with a skin pen and ideally photographed prior to treatment. 2 pulses of treatment are suggested for HS skin lesions and 1 pulse for the rest of the skin region, for example the axilla. Generally, an interval of 4 weeks between treatments is recommended, and in most cases, an initial course of 4 treatments is undertaken. Subsequent treatments may be required because the effects of laser and IPL are often temporary. Note that complete hair removal is not the aim of the procedure, and so some hair may remain. Hair may continue to exfoliate and fall out for up to 21 days following a procedure. Post-procedure care. If the sensation of local warmth continues after the procedure, then a cold compress can be used, while ice should be avoided. Oral pain relief can be taken if required. Clothing that is tight across the treated skin region should be avoided. Other physical skin treatments and excessive sun exposure should be avoided until the skin is recovered, which generally takes about 5 to 10 days. The clinic should provide contact details for any further queries. Theseus. Thank you for watching this video, which has been prepared as part of the legacy of the Theseus study, which introduced laser therapy and deroofing for HS into the UK. A similar video describing deroofing is available via our Theseus website and via YouTube with the link provided.